Hello and good afternoon, everyone. First off, please allow me to just quickly thank the Philippine Society for Microbiology and Infectious Diseases for this invitation as a resource speaker to your 42nd annual convention and be able to share a little bit with our audience an introductory presentation and how to actually practice mindfulness in the midst of these trying times that we are all facing. So we are now going into the ninth month of COVID-19 since it was declared by the WHO as a global pandemic in March. And I think that we will all agree that at this point, to say that it has been a wild roller coaster ride in almost all aspects of our lives might actually be an understatement. If we are going to reflect on our COVID-19 journey, from the get-go, of course, our main concerns have been centered on how the virus can potentially threaten our physical well-being, with our strongest worry or fear being, what if I get infected by the virus? So that's whether being infected ourselves or our loved ones. So we all experience that worry or fear to varying degrees. And having said that, we want to highlight as early as now that it is a normative or a normal reaction for us to be apprehensive and anxious. On top of that, there are other associated anxieties, such as is our government and our healthcare system able to adequately manage the healthcare crisis? And if so, will they be able to continue to do that over time? And then, shortly thereafter, our worries turn into the more personal stuff like what if I lose my job? Or for those who have actually lost their jobs, there's the question how will I make ends meet? Or even if our concerns are not as catastrophic, meaning we are not lacking in the basics like we are able to eat 3 times a day or we have a roof over our heads, still, to the average person, there's now that challenge of juggling time within our new normal, as we call it, which for most of us may include working from home, homeschooling the children, and stuff like that. So, all of us are in a constant loop of this new normal, with a constant chatter of worries going on in our heads. But basically, what we are really saying is that since the pandemic started, relatively little attention has really been paid to the mental health consequences of the pandemic. And to a certain extent, this is quite understandable, now most especially in the acute or earlier stages of the crisis, because at that time, the emphasis should really be on the more urgent priorities anyways, such as caring for the sick patients, tending to the needs of our healthcare providers so they can meet the challenging medical demands while keeping them safe at the same time. There's also working on containing the virus so further spread in the community can be prevented, or even expanding our hospitals' capacities and putting up quarantine facilities to accommodate more patients. And then, on top of all of these, we also needed to work on developing effective treatments for the virus. So, there was an immediate need to attend to that because we were dealing with such a virulent and potentially fatal virus. So, that's whether curative or preventive, such as a vaccine for COVID 19. But meanwhile, there's this generalized psychological distress and anxiety that all of us are experiencing. So, to begin with, our lives and daily routines have been completely disrupted. And for the past 9 months, we have actually been grieving the loss of our former lives. So, we are all essentially in grief at the moment. And it is not just the kind of grief that we feel when a loved one dies, because this grief over the loss that COVID 19 brought about is quite complicated because it brings with it so much uncertainty. And aside from this, we have been isolated from each other. There's the economic and financial losses that we continue to accumulate over time. So, all of these things can definitely have adverse effects on our mental and emotional well being. And this is what we refer to as the psychological sequelae that will eventually emerge even as the pandemic eases up. And they actually say that these may persist for months or even years, even after the end of the pandemic. And right now, we still do not know what the long term effects of these psychological consequences will be. What we do know, however, is that even during the very early stages of the pandemic, there have been case reports which have described psychiatric and psychological symptoms, in fact, even neurological symptoms, now that were associated with COVID 19. For instance, in the province of Wuhan, where it was supposed to have all started, during the initial outbreak of the pandemic, they actually did a longitudinal study of psychological symptoms, which they repeated 4 weeks later at the peak of it. And they noted that the respondents reported high levels of anxiety, depression, as well as stress and distress, which was in fact also validated later by an online survey that yielded more or less the same results. So it showed high rates of anxiety, depression, alcohol use, and decreased mental well being among the respondents. And then a little later on, there was also a much bigger nationwide surveillance conducted in the UK, which is supposed to be the largest and first ever nationwide study since the onset of the pandemic. And it showed COVID 19 to manifest acute psychiatric and neurologic complications like ischemic strokes, brain hemorrhage, or as I mentioned earlier, depression. There was also mention of personality changes. There's the triggering of manic episodes in bipolar disorder, or even new onset or first episode psychosis. But perhaps most importantly, there were studies which showed that COVID 19 patients who also had comorbid or simultaneous diagnosis of a psychiatric disorder showed consistently higher mortality rates as compared to those who did not have a psychiatric diagnosis or disorder. So, in other words, COVID 19 patients who were also psychiatric patients had a higher risk for death versus those who were only dealing with COVID 19 alone. So, this one I'm flashing on the screen right now actually just came out about a month ago. So, needless to say, attending to our mental health during this time is actually very critical. Maybe not only in keeping our sanity or psychological integrity, but perhaps even our physical survival. So, for this hour in this presentation, I will be sharing with you a psychological strategy. I would actually prefer to call it a practice or even a lifestyle. And this one is an area in the mental health field that we can say has been catching quite a lot of interest and attention, especially in the last 2 decades or so. Although in actuality, it's been there for much longer. And this is the practice of mindfulness. So, in psychiatry, even pre pandemic or even before the advent of COVID 19, two of the most common conditions that we encounter in the clinics are depression and anxiety. And this still holds true in the midst of the pandemic. And if we are going to relate depression and anxiety to mindfulness, when we are not mindful, taking into consideration that one aspect of mindfulness is being fully in the present moment or being in the here and now. So if we look at this time frame that I'm flashing on this slide, when one is not in the middle, which is the here and now or the present, one can only be in two other time frames, which would either be in the past or in the future, whether immediate or distant past or immediate or distant future. And the general rule in mindfulness is that, on one hand, when one is depressed, more often than not, one is dwelling about the past. And of course, when we think about the past, not uncommonly, we think about the should haves, would haves, the could haves. So, all of those things that we did or did not do that we regret. Or on the other hand, when you think about the future, more so if you think about it catastrophically, now, which means that you're thinking about the worst case scenario that might happen or the worst outcome of your present moment, then there is no way for you to not feel anxious, right? I mean, how can you feel good or at the very least relaxed or neutral when you're having catastrophic thoughts? So it just doesn't make sense, right? So, as a simple rule, being more in the past than the present will make you more inclined to be depressed. And conversely, being more in the future than the present makes you more inclined to be anxious. Why is that? Because that is simply the nature of the future. It is basically uncertain. So we do not know what it is going to bring. We do not know exactly when the vaccine will come out, right? We do not know whether next week or next month we will be COVID free. But on the other hand, if it so happened that you do have COVID in the present moment and you are constantly thinking or worrying about your mortality, do you ever consider the possibility that a month from now you may actually be completely COVID free and going about your usual activities and be fully functional? So, in other words, what if, for just a while, you let go of all of those worries and apprehensions that you're holding in your mind, no? And just focus on this present moment, fully focusing on what is happening right now? Maybe focusing on your breath as it goes in and out of you, even for just a few cycles of your breathing. Or if in the process of doing so, you find your mind wandering somewhere else, again, either to the past or the future or to a neutral thought, then just acknowledge that your mind has wandered and gently refocus on your breath. So, what I have just described just now is a very basic and simple mindfulness exercise, which I will actually guide you to do a lengthier version of a little later. So, mindfulness or being mindful holds a unique and special potential of transforming the nature of our experience, whether that experience may be something that we do ordinarily on a day to day basis, like eating or brushing your teeth, or even just walking, if only we pay special attention to it. And I'd like to point out as early as now that mindfulness is not just about paying attention more thoroughly, but it's actually about paying attention differently. So it is changing how we pay attention, such that we are able to experience anew and in a different way something that we have already done countless times in the past. So, what is mindfulness? Before I define mindfulness, I actually would like to first present you with a question which I think would help you appreciate more the concept. And the question is this: are you thinking about something other than what you're currently doing? So, aside from the obvious fact that you're seated there listening to me, I hope, are you thinking or are you experiencing something else? So, my point in asking that question is that that is the way we are really built. No? It is the human condition, so to speak. To quote Matthew Killingsworth and Daniel Gilbert in a recent paper they wrote, so Killingsworth and Gilbert are researcher psychologists from Harvard University, and they said that unlike other animals, human beings spend a lot of time thinking about what is not going on around them, contemplating on events that happened in the past, or events that might happen in the future, or events that actually might not happen at all. So we are almost never in the present moment. And that is what we refer to as stimulus independent thinking or simply mind wandering, which is said to be the brain's default mode of operation. And even though research has established the cognitive and neural basis for mind wandering, however, very little is still known about the emotional consequences of it in everyday life. So, what these two brilliant Harvard researchers did was to come up with a web application for iPhone, which I think it also works for Androids. The application is called Track Your Happiness, and the website is www.trackyourhappiness.org. And this contains a large database of real time reports of participants and their thoughts, their feelings, their actions as they go about their daily activities. So, what happened was the participants were sent daily notifications via email, which asked them a set of questions like: how are you feeling now? Or what are you doing now? What are you doing at this particular moment? Or are you thinking about something other than what you're actually doing, etc.? So I personally joined as a participant in this study, and it is really not that much of a task. So all you need to do is to answer a short set of questions, which takes about 3 to 5 minute stops. So you do it for about 10 to 12 days, and at the end of your participation, they email you a report which mostly contains graphs of the different variables and your respective level of happiness in relation to those factors. So, what were the general findings of this large scale study? First, was that people's minds do wander frequently, nearly half of the time, in fact, regardless of what they were doing. The second finding was that people were less happy when their minds were wandering than when they were not. And the third and the last is that what people were thinking was a better predictor of happiness than what they were doing. So I'm not going to go through the details of these findings, but in a nutshell, what the results of this study says is that a human mind is a wandering mind, and a wandering mind is an unhappy mind. And so becoming aware of what is on our minds from moment to moment, at least as much as we could, and how our experience is transformed when we do become aware, is what mindfulness is really all about. And the operational definition of mindfulness, according to John Kabat-Zinn, and just to give you an idea, John Kabat-Zinn is the original proponent of mindfulness and the person mainly responsible for bringing the mindfulness meditation practice in mainstream medicine. And so he defined mindfulness as the awareness that arises by paying attention on purpose in the present moment and non judgmentally. Oftentimes, John Kabat-Zinn would said, as if your life depended on it. And so to practice mindfulness is to really inhabit the present moment and make good use of what we are experiencing in order for us to optimally learn in the process. And I want to emphasize that mindfulness or awareness, which is a term used for mindfulness, is not the same as thinking. Because mindfulness is much more powerful than thinking. And the reason for this is because when we are aware, when we are fully in the present moment, then we know what is actually happening and therefore we can respond to the situation most appropriately. And just to say a bit further about John Kabat-Zinn, he is a scientist and a professor emeritus at the University of Massachusetts Medical School, where he founded the Mbsr program, or the Mindfulness-Based Stress Reduction Program, which is an 8-week program on mindfulness. So he initiated this program in 1979 and since then has been adopted by numerous medical centers all over the world. And the MBSR program has been based on the principle of what we call participatory medicine, wherein the individual patients are encouraged to engage more fully in their movement toward greater levels of health and well being, not necessarily as a replacement for medical treatment, but as a vitally important complement to it. So it's a program that we would usually find under behavioral medicine or mind, body, and integrative medicine. And this has been based on the perspective that psychological and emotional factors have a significant effect on our physical health. But not only that, but it also includes our capacity to recover from illness and lead lives of high quality and satisfaction, even in the face of chronic disease, chronic pain, and endemically stressful lifestyles. So oftentimes we would see patients enrolled in the MBSR who are suffering from cancer or AIDS, heart disease, chronic pain, and of course, the more common psychiatric conditions like depression and anxiety. So, in other words, diseases and conditions of the young, the old, and the in between. So there are basically two types of mindfulness practice, which is the formal practice and the informal practice. Now, from the mindfulness perspective, the main mode in which one is able to apply the formal practice is actually through meditation, which is mainly divided into the sitting meditation and the standing or the walking meditation. Now, the sitting meditation is where the most basic mindfulness meditation practice would fall under, which is called the body scan. Now, but apart from the body scan, we also have a variety of sitting meditations, such as sitting with the breath. So it involves focusing on the breath, following it as it goes in and outside of us, just like what I was describing earlier. But aside from focusing on the breath, we can also either focus on the body as a whole, we can focus on sounds, we can focus on thoughts or even feelings, or we can do a combination, like the sitting with the breath and the body as a whole. But a very important ally that needs to accompany your meditation is actually your breathing, because it is what grounds you or anchors you most in the present moment. Because if you think about it, aside from our bodies, the breath is another dynamic thing that reminds us that we are still alive, because it is dynamic, it is happening all the time. So it can serve as an important anchor in our meditation practice. Apart from meditation, the other important formal mindfulness practice is actually yoga, which is geared toward cultivating physical strength, balance, and flexibility. So, specifically in the mindfulness meditation practice, they do the Hatha Yoga, which mainly consists of gentle stretches, strengthening and balancing exercises, which are done very slowly and with moment to moment awareness of the breathing, as well as whatever situations arise as one does the postures. So I'm not going to go through this in detail, but I just wanted to show you this so you have an idea what happens in the MBSR program. So as you can see, on a weekly basis, they do certain sets of mindfulness practices, whether the formal practice, which involves the meditation, or the informal practice. And I just want to let you guys know that there's actually online MBSR programs. So, for instance, for the University of Massachusetts, they actually hold online MBSR programs, and the price range would be about 200 to 700 US dollars. But for today, I'd like to share with our audience a little bit of a bonus, which is actually a free online MBSR program or mindfulness based stress reduction program. So you can just log on to www.paloozemindfulness.com. And this free MBSR program is actually facilitated by Dave Potter, who is a fully certified MBSR instructor by the University of Massachusetts Medical School itself. So he has been practicing it for 12 years. And just to give you a bit of a background, he is actually a retired psychotherapist and a daily meditation practitioner for 25 years already. So you can begin whenever you're ready. So, as you can see, mindfulness practice is very much in harmony with the principle of mind body medicine, or what is sometimes called integrative medicine. Others would refer to it as participative medicine, wherein the patient or the individual takes an active part and fully engages in one's health and well being. And I actually personally believe that this is the general trend nowadays, not only with mental health, but with healthcare in general. So I think gone are the days when the patients are fully satisfied with just letting the healthcare system take care of what is wrong with them. So the patients usually go to the doctor prepared with questions, and even after that, they would actually search a lot of things on the internet. And the term healthcare for me is quite a misnomer because what medicine has really been doing for the most part is actually disease care or disease cure. Because out of the 10 times that we go to the doctor, how many times do we actually go healthy? Meaning nothing is really wrong with us and we just want to maintain our level of wellness. It's actually almost never, because when we go to a doctor, most of the time there's something wrong with us. We are suffering from a medical illness. So, what I would like us to do now is for us to pause for a few minutes, and please allow me to guide you through a brief mindfulness meditation exercise, which is called the breathing space. And I'm choosing this particular mindfulness exercise, keeping in mind that majority of our attendees are medical frontliners, who I'm conjecturing is under a considerable amount of pressure in the midst of the pandemic. So I'm choosing this because it is the most practical in terms of time investment, since it is a relatively short exercise. So it's particularly fitting for those who may not have that much time to devote to something like this. I actually call this the ideal meditation exercise for quote unquote non-meditators, or people who are not naturally inclined to doing meditation. So we'll be starting the exercise at the sound of the bell. So first, try to quiet down and wind down into the present moment, and find a comfortable and stable posture, either sitting or lying on your back. If you choose to continue sitting, just allow your back to be straight but not rigid. Let your arms and hands rest on your thighs in a relaxed position. You may want to close your eyes if it feels comfortable, or if not, just try to soften your gaze in one place and not focusing on anything in particular. Now I want you to bring your attention to the present moment by noticing how you're feeling physically, scanning your body beginning from your head and your neck, to your upper body, your chest and your abdomen, your arms, your forearms and hands, down to your pelvic area, your thighs, your legs, all the way to your feet and toes. And now try to just consciously let go of any tension and just let it slip away. Now I want you to take a moment to notice your environment. Any sounds you might hear in the background, or even what temperature feels like in the room you're in right now. And now start bringing your attention to your breathing. First, noticing the sensation of your breath going in and out of your nostrils or your mouth. or as you continue to breathe, paying attention to the rise and fall of your chest. Or conversely, noticing the rise and fall of your belly. And just follow your breath for its full duration, from the start to finish. Notice as well that the breath happens on its own, without any conscious effort. You don't need to control it, but rather, you just need to notice and observe it. Again, if you find it helpful, you can say in to yourself on each in-breath, or out and relax on each out-breath. And each time your mind wanders away from the breath, which for sure will happen, simply notice where it goes, and then just gently bring your attention back to the breath again as it goes in and out, in and out. And when your mind wanders, you can just make a mental note of it. For example, if you drift away from your breath to thinking about the future, you can say to yourself, just now, I have drifted off to planning. Or if your mind is pulled to a sensation of pain or discomfort in your body, you can say to yourself, just now, I am feeling pain or discomfort. Tell yourself, whatever it is, it's already here. Whatever it is, it's already here. Let me feel it. Or if you notice you're focused on something worrisome from the past, again you can say to yourself, just now I am worrying. And then again, after all of these thoughts, just simply and gently bring your attention back to the present moment every time without judgment. And once again, focusing on the breath. So try to practice this exercise for a few minutes or longer if you'd like every day, noticing how it feels to spend some time each day just being with your breath, just being with what is happening in the moment, just being the self that you are in that particular moment. At the sound of the bell, we will finish the exercise. You will open your eyes, be fully awake, fully alive, fully in the present moment. So, how did that feel? So, when we practice mindful breathing, it is like you're strengthening your muscle of living in the moment. And as you practice more, you'll find it easier to be in the here and now more, rather than being caught up in the past or some worry about the future. And obviously, if you try to live in the now more, then you will tend to feel more peaceful and clear. Even when your external circumstances are difficult, just like the unusual stress that our world is in right now. And I just want to make it clear that mindfulness practice is not tuning out the world or denying the reality of what is happening in the present. In fact, it is about tuning into the present, but with a more open and compassionate awareness. So I would just like to briefly bring back the slide which says that mindfulness is not about paying attention more thoroughly, but rather it is paying attention differently. So, for instance, one of the most basic recommendations of global health experts and health organizations is hand washing. Even with this simple act of hand washing, you can actually turn that into a mindfulness exercise. So there's this director of the Yale Stress Center Mindfulness Education Program, whose name is Ann Dutton, who suggests that maybe instead of going about it in your usual way when you wash your hands, perhaps before you begin the activity, you can set an intention to focus on the sensations associated with the activity of hand washing. So you may pay attention to any thoughts that arise or any emotions you may feel while you're doing that. Or from moment to moment, pay attention to the feel of the water or the application of the soap to your hands or even the smell of the soap as you rub your hands together. So if a thought pops into your head while you're doing that, or if you start to feel anything or any emotion, just notice that, but again, go back to the sensations of washing your hands, which serves as your anchor, instead of the breath, as we did just a while ago. So, this is another very practical mindfulness strategy that I'd like to share with you, which is to practice STOP, which is an acronym that stands for STOP. So, that's what S stands for. Then follow it by T, which is to take a breath. And then O stands for observing your feelings. And lastly, P stands for proceed. So very simple and does not require a lot of time and effort. It will not even take you a minute. So if you can remind yourself to do this throughout the day, even while you are in the line of duty, this will most definitely make a difference in your stress levels. So, I would now like to segue into discussing the basic foundations of mindfulness practice, which really consist of a set of attitudes that we need to adopt and develop over time. So, generally, it is the attitude of paying attention to the present and being in the present that is most crucial, which means that the last thing you should be doing is to force yourself to feel something or to demand of yourself that something needs to happen. So you shouldn't be like opening your eyes and checking the time every once in a while. I've been sitting here for 15 minutes. I should be feeling more relaxed by now. And why is nothing happening yet? And the best analogy I think I can use for that is sleep. So if you're in bed and then you suddenly become aware, oh, it's 11 p.m. and my usual bedtime is at 9. So why am I still not sleeping? And then you start to get apprehensive and you tell yourself, oh no, I have an early meeting tomorrow. I should be up by 5. So I should be sleeping by now. And you force yourself to sleep. Do you seriously think you would be able to achieve sleep? And actually, the same is very true for relaxation. So you cannot achieve the state of relaxation by force of will. because doing that will only produce more tension and frustration. So, in the end, what you achieve is the exact opposite of relaxation, which is tension or anxiety. And what about depression? From the perspective of mindfulness based cognitive therapy, or MBCT, which is one among the many psychotherapeutic approaches, one important factor that maintains the depression or even intensifies the depression is actually the patient's emotional reaction to the emotion of sadness. So, why am I feeling miserable again? Now I feel miserable for feeling miserable. So it's actually the reaction to the sadness that makes the patient feel more miserable or sad. In fact, oftentimes the attempts to feel better are what actually makes the patient feel worse. So therefore, at the end of the day, the problem is not the sadness itself, but how our minds react or respond to the sadness. So, what are the seven attitudinal foundations? First and foremost is the attitude of non judgment. So, just like mind wandering, it is in the nature of our minds to constantly generate judgments about our experiences. So, we tend to label, we categorize, and usually in terms of what the value is of what is happening to us at a particular moment. So, it's either this is good, or this is bad, or this is neutral. But when we do this, then we are not able to discern what may be actually happening, whether inwardly, which means our internal experiences, or outwardly, which is what is happening externally. An exercise that you can do later to prove this idea is to give yourself a 10-minute period, or maybe even just 5 minutes, and observe how much liking or disliking is happening in your mind as you go about your usual activity. So as it turns out, even if you are not doing anything, up here in your mind, you are very, very busy. And when practicing mindfulness, the very first step is to recognize this judgment or this judging when it appears and consequently intentionally suspend judgment. So it is assuming a stance of impartiality, reminding yourself as best as you can to simply observe whatever is unfolding, including your reactions to it. The next attitudinal foundation is patience, which, from the perspective of mindfulness practice, is actually a form of wisdom because it demonstrates that we understand and accept the fact that sometimes things must unfold in their own time. A metaphor that John Kabat-Zinn uses to embody this idea is the developmental process that a moth goes through before it eventually becomes a butterfly. If it is at a stage where the moth is still enclosed in a chrysalis or a pupa, waiting to become a butterfly, if you force it and break it open before its time, you're actually endangering the creature more than nurturing it. So, in the same way, we should cultivate patience toward ourselves when practicing mindfulness. We should not hurry the process and keep in mind that whatever moment we are in is really the only moment we have, and therefore it is futile to be rushing to the next moments. Because if you think about it, whatever moment you are in is really the only moment you have, and therefore it is futile to be rushing to the next moments. And the attitude of patience is also something that we can try to invoke during times when we find the mind wandering or agitated. So, what you do is first acknowledge and accept this tendency of the mind to wander, and subsequently remind yourself that you don't have to get caught up in it. Then gently redirect yourself back to the present, accepting it in its fullness. Another important attitudinal foundation is having what is called a beginner's mind. So, almost all the time, what we know, in other words, our established ways of thinking, influences the way in which we see or perceive things, and therefore preventing us from seeing things as they really are. So, in other words, what we know, quote unquote, gets in the way of our experiencing the richness of the present moment. So, having a beginner's mind means that there should be that willingness to see what is happening as if for the first time. So, it means we free ourselves of our expectations based on our past experiences. I would like you to try another simple mindfulness exercise, which is that the next time you see somebody you know, it could be your partner or your children, your parents, friends, co-workers. Just try to observe whether you're seeing this person in front of you with fresh eyes. Or are you seeing this person based only on what you already know? Or how you already feel about the person? In fact, you can also try this exercise with a recurring problem or issue. So are you seeing the issue as it actually is right now? Or are you seeing it through the veil of your established thoughts and emotions and opinions? So having a beginner's mind allows us to be receptive to new possibilities by acknowledging the fact that no moment is the same as any other, and that each is unique and therefore it also contains unique possibilities. Another attitudinal foundation is trust, and this is somewhat self explanatory, which means that we need to develop a sense of trust in ourselves and our feelings, our basic wisdom and goodness. So, even if we make some mistakes along the way, we need to make an attempt to trust our own authority and intuition. And this attitude is particularly useful in one of the practices in mindfulness, which is that of yoga, where you will have to trust your experience of your body, which means that you need to stop whenever something does not feel right. Otherwise, you might injure yourself. So, alongside this trust should be the responsibility for and learning to listen to oneself. Next is the attitude of what we call non striving. So again, it is another basic rule for us human beings that whenever we do something, we almost always do it for a purpose. No, it is because we want to get something or we want to get somewhere. But in mindfulness practice, especially when you are doing the meditation, this can be a real obstacle because even though meditation takes some amount of effort, ultimately, meditation is about non doing. So it does not really have any goal other than for you to be yourself at that particular moment. So it is really just about being, period. But you see, the irony of it is that you already are whoever you are at any given moment. So striving is really not even necessary to begin with. And all that really needs to happen is for you to just be. And just to illustrate a little further, if you're practicing mindfulness meditation and you think, I'm going to get relaxed, or I will be less anxious or less depressed, or I will be able to control my pain better, or even if you don't have any clinical condition and just tell yourself, I'm going to get enlightened and be a better person. So, what is happening there is you're already introducing an idea to your mind of where you should be. And not uncommonly, along with the idea comes the notion that you are not okay right now. So you may as well be thinking, if only I were calmer, or less anxious, or less depressed, or feeling less pain or discomfort, then I would be okay. But right now, I'm not okay because I'm not where I need to be, or I want to be, or should be. But the attitude of mindfulness involves simply paying attention to whatever is happening, embracing it, and holding it in awareness. So when patients get referred to the Mbsr program, the first time they come, they are actually asked to identify 3 goals that they want to work towards. So they're asked to write them down on a piece of paper, and oftentimes it would be either I want to be feeling less depressed, or I want to be able to reduce my pain and anxiety, or I want to be able to manage my hypertension better and lower my blood pressure. But much to their surprise, what they're asked to do next is to actually throw away that piece of paper of goals. So what they're asked to do next is to not to try to make any progress towards those goals. And instead,
Just stay in the present and carefully follow the program and meditation instructions. So, in mindfulness practice, the best way to achieve your goals is to actually back off from striving for results and instead just focusing carefully on seeing and accepting things as they are, moment by moment and breath by breath, as John Kabat-Zinn would put it. So again, the irony of it is that in doing this, movement toward your goals will take care of itself. The second to the last attitudinal foundation, which is closely related to non-striving, is acceptance, which from the mindfulness perspective is defined as seeing things as they actually are in the present moment. In fact, John Kabat-Zinn's definition of healing is it's not so much a resolution of the medical illness that you're dealing with, but it is more of coming to terms with things as they are in the present moment. So if you have a headache, then accept that you have a headache. Or if you're overweight, you can accept it as a description of your body at this moment, at this time. So rather than wasting time and energy denying what is already fact, or trying to force situations to be the way we would like them to be, which only makes for more tension, what mindfulness advocates is to take each moment as it comes and be with it fully, as it is. So it is to just be receptive and open to what we are feeling or thinking or experiencing because it is what is here right now. Again, the irony in mindfulness practice is that acceptance of the present is what actually leads to the change and gets you to the future that you want. And the last attitudinal foundation is letting go. So in India, when they are trying to catch monkeys, they have a rather clever way of doing it. And the strategy is to get a coconut husk, put a banana inside, and secure it to the base of a tree trunk such that it doesn't move. And what they do is to drill a hole in the coconut that is just big enough for the monkey to put its hand through it. So what happens is the monkey approaches the coconut, put its hand in, and tries to take the banana out. But the thing is, this particular hole is cleverly crafted in such a way that the open hand of the monkey can go in, but the fist cannot get out while he is holding on to the banana. So, if you think about it, all the monkey really has to do to be free is to let go of the banana. But guess what happens? Most monkeys actually opt to hold on to the banana and be trapped where they are. So does that sound familiar? In spite of our human intelligence, our thinking often gets caught up in the same manner. So there are certain experiences that the mind gets trapped into, whether pleasant or unpleasant. So on one hand, if they're pleasant, we try to prolong these pleasant experiences. And on the other hand, if they're unpleasant or painful or frightening, we compulsively protect ourselves from them. And in mindfulness practice, what we try to do is we intentionally put aside the tendency to hold on to some experiences or reject others. So when we observe our minds either grasping onto something or pushing away something, we need to remind ourselves to make an attempt to let go and see what happens next. So when we find it particularly difficult to let go of something because it has such a strong hold over us, what we can do is to remind ourselves that letting go is an inherent capacity that we all have. We have done it at several points in our lives. In fact, we do it every night. When we go to sleep, we are essentially letting go of our minds and bodies. Because if you do not let go, then you cannot sleep. So if you can go to sleep every night, then you're already an expert in letting go. And you just need to try something new and practice applying this skill in waking situations as well. So I asked you the question, what is your banana? On top of the 7 attitudinal foundations that I have just discussed, there are other attitudinal qualities of mind or attitudes that contribute to deepening the mindfulness practice, and they include non harming, generosity, gratitude, forbearance, forgiveness, kindness, compassion, empathic joy, and equanimity. And if you think about it, these qualities are very much related to the 7 foundational attitudes and naturally arise from them. So, what about research? As regards to evidence based studies on mindfulness, there are actually quite a number of existing publications already as we speak. So, if you check out this bar graph, it summarizes all the existing number of publications on mindfulness by year, beginning in the early 80s up to 2018. And as you can see, the numbers of the studies being conducted have consistently increased by the year. Of course, these numbers encompass all of the studies on the various areas where mindfulness is being applied. So, for starters, there are ongoing researches on its mainstream clinical applications, such as mindfulness based stress reduction, which I mentioned earlier. There's also MBCT, or mindfulness based cognitive therapy. There's mindfulness based programs for substance abuse, mindfulness based relapse prevention, anxiety and traumatic stress disorders, and its application on eating disorders. There are also ongoing studies of its application on general wellness, contemplative studies in Brown University, integrative medicine division of Duke University, cognitive, affective, and contemplative neurosciences division of Harvard Medical School, just to name a few. It's also being applied in schools, so the educational system and its effects on both the students and the teachers. There's also mindfulness based programs for youth and families. It's being applied in law, business, technology, leadership, sports, economics, even politics and government. So, the practice of and research on mindfulness are all encompassing and have cut across the various facets of living. So, on a final note, for those of you who might be interested to check out mindfulness a bit more, a good website to start with is www.mindfulnessexperience.org. So, this website provides you a basic introduction of what mindfulness is all about, the different mindfulness interventions. There's also an entirely separate section there which provides reviews of the existing evidence based studies. There's also a long list of existing mindfulness research and treatment centers indexed by the USNIH, or National Institute of Health. They also have a monthly newsletter called the Mindfulness Research Monthly, which provides regular research updates as well as upcoming events and conferences. So, I hope that by now we have somehow been able to gain a deeper appreciation of what mindfulness is, that it does not just strictly equate to meditation or yoga, that its application is not limited as a psychotherapeutic technique or strategy like CBT or cognitive behavioral therapy. Although it could very well be, it extends far beyond that. And in essence, mindfulness is actually a way of being, the purpose of which is to connect us with our capacity to see and embrace the actuality of things, and in a way that is healing and transforming. And as the Buddha said, refuge to the man is the mind, and refuge to the mind is mindfulness. And with that, I'd like to thank you guys for your kind attention.
Okay, thank you very much, Dr. Samaniego. May mindfulness help all of us, pandemic or no pandemic. In the interest of time, we cannot anymore have the question and answer session for Dr. Samaniego's talk. And we would like again to thank Dr. Samaniego for your talk to this afternoon. And we would like to give you this certificate of appreciation from the FPSMID. Thank you very much again.